When you think about your overall health and well-being, there are so many facets that are important to achieve genuine health. There's the medical, the dental, the mental health, social, the spiritual, nutritional, and educational components. And that's one thing we're trying to strive to create here at the Good Samaritan Health Center as a complete circle of health, where we can address every potential health need that a patient has, all in one location, one roof, for the entire family.
It's so good to see you.
It's good to see you.
The vast majority of the patients we see are good, hard-working people. They just don't make enough income to afford health care. Their employers do not provide traditional insurance for them. They're hard-working people. They're maids in hotels, they're cooks in fast food restaurants, they're men who are blowing leaves off your yard, they're putting roofs on your houses. They're doing these kinds of yeoman-type jobs, and yet they have no health insurance. So consequently, we are their doctor.
I had pneumonia back in 2007 and very sick. And I had to go to Emory Adventist Hospital. During that visit, that's when they referred me to Good Sam.
Hello, welcome to Good Samaritan. How can I help you?
I had no idea what Good Sam was until I showed up about 2 weeks later. And I'm glad I'm here now. I was just grateful that somebody thought enough of me to recommend me to Good Sam. Oh, I was grateful. I jumped for it.
In my life, being on a fixed income, which is Social Security, I'm on a budget, okay, and couldn't possibly afford any dentist whatsoever. Good Samaritan coming into my life is giving my mouth a new outlook on life.
I know, you're doing great.
It's like coming back to family. I know so many of the people here. A lot has changed over the years, but I know a lot of the people, and they've always looked out for not just my son, but for myself. I've been very ill, and now I'm fine, and I can attribute a lot of that to the good care here at Good Samaritan.
All right, so now we're gonna do lateral. Yep.
I always thought like it was the providers that were so important, and they very much are, but it's like the patients that are here. When you see how happy they are when they leave, it's really cool. I mean, it's unbelievable.
The patients are amazing. It's very rewarding, just with the smiles, the hugs you get when they finish a treatment plan. It's just very rewarding. We love it.
They set me up on the dental plan. I followed it, and I'm still following it, and now I have a bright, pretty smile.
So let's put it on our holy pasta. It is all about them, because this is making changes is going to help them out later on in life. It's going to have an impact on their children and their other family members. And it's all about making sure that they feel good, that they look good, and that we prevent them from having chronic illnesses or maybe reduce the amount of medications that they're taking.
See ya. Oh, I get another hug from Batman. We don't know how to dumb it down. We don't know how to do B-level service. So our patients who may be financially needy still get the same level of excellent care that anybody would get going to a traditional Buckhead practice or suburban Atlanta practice.
A lot of people ask me, well, who do you go see? You know, how are you being taken care of? First thing comes out of my mouth, Good Sam.
I have brought people here to get the good medical care and dental care that I've received over the years. This place needs to be here.
This place is needed all over the country as far as I'm concerned. And anything I could do to contribute to help them, to get donations to help make this place better and more operable, I would love to do that for them.
It's good in quality, quantity, and I just love it, and I hope God keep y'all strong and keep this building strong and healthy.